Infection associated with healthcare is the most common adverse event affecting hospitalized patients.
Hand hygiene is the most important preventive measure against these infections.
The compliance with these simple procedures among the healthcare providers is often below 40%.
Hand hygiene is an essential procedure for all healthcare providers. It serves 4 different purposes in the healthcare setting.
Hand hygiene prevents nosocomial infection in patients and the cross-contamination of the microorganisms between patients.
Hand hygiene prevents the contamination of the hospital environment with potential pathogens.
Finally, it helps protect healthcare providers from occupational infectious disease, such as infection of human immunodeficiency virus and hepatitis C virus.
Might seems crazy what I'm about to say. Infection is here, you can take away. Like a hot air balloon, they could go to space. With the air we all breathe and everywhere.
Because hand hygiene.
Wash your hands before and after you enter the patient's room. Wash your hands before you do an aseptic procedure. Wash your hands after touching the patient's surrounding. Rub along if you feel like that's what you wanna do. Here come good news, talking this and that.
Yeah.
Give me all you got, don't hold it back.
Yeah.
But I should warn you, I'll be just fine.
Yeah.
No offense to you, don't waste your time. Here's why.
Because hand hygiene.
Wash your hands before and after you enter the patient's room.
Because hand hygiene.
Wash your hands before you do an aseptic procedure.
Because hand hygiene.
Wash your hands after touching the patient's surrounding.
Because hand hygiene.
Rub along if you feel like that's what you wanna do.
Happy.
Infection down, is nothing. Bring them down. HealthServ's happy to bring them down. cold is nothing, bring them down, bring them down. Pneumonia's nothing, bring them down. HealthServ's happy to bring them down. Pseudomonas now, bring them down, bring them down. We said,
Hand hygiene.
wash your hands before and after you enter the patient's room.
Because hand hygiene.
Wash your hands before you do an aseptic procedure.
Because hand hygiene.
Wash your hands after touching the patient's surrounding.
Because hand hygiene.
Rub along if you feel like that's what you wanna do. Infection down, high's nothing, bring them down. HealthServ's happy to bring them down.